In 2020, there was an estimate of 241 million cases of malaria worldwide, while the death rate stood at 627,000 in the same year, showing an increase of 65,000 deaths from 2019. On that note, I welcome you to your favorite health program on radio, Your Health on Ray Power 95.1 FM Ibadan. Your Health is a health awareness program where you get informed and educated about the well-being of your body. And don't forget, once it is 10:30 a.m. every Wednesday morning, the program kicks off. I remain your humble host, Nedu Okorie. You can simply call me Nedu. In the absence of your health professionals, I will be your radio doctor. I appreciate the producer of the program, Madam Folakemi Awoshen Agbakoba. Alright, let us do a quick recap of what we discussed in the previous edition of the program, Your Health. Last week we talked about building up healthy cells in the body through the kind of food we eat. Yes, I mentioned a lot of food that we eat that promotes diseases in the body. Rather than building up the cells, they promote diseases in the body. And I also gave alternatives. We said a lot of food actually degenerate and damage cells, and it makes us look older than our age. Alright, today we'll be looking at something different from what we discussed earlier. For those who are yet to follow me on social media platform, you can do so now. You can go on Facebook and search me at Nedu Okorie. On Instagram, I am at Nedu_Okorie. Also on Twitter, I am at Nedu Okorie. You can also make your contributions on the program by sending your messages to any of my social media handles. Anyone is available. You can make your contributions. This week we're going to be looking at something different. The topic of today is reducing malaria disease burden. Reducing malaria disease burden and effective immunization. Reducing malaria disease burden and effective immunization. On Monday, the 25th of April was set aside to celebrate and observe World Malaria Day. World Malaria Day is an annual observance throughout the world to raise awareness about the life-threatening disease known as malaria, as well as to encourage people to come together to prevent it. It was observed on Monday, the 25th of April, throughout the world, and a lot of organizations, a lot of individuals also contributed in their own way to campaign against the menace of malaria that is threatening the region of Africa, especially Nigeria. This year's theme for the World Malaria Day is harness innovation to reduce the malaria disease burden and save lives. Harness innovation to reduce the malaria disease burden and save lives. That was where the topic of today was coined from. Harnessing innovation simply means making use of technological tools. The recent technological tools to reduce the malaria disease burden that is prevalent in Africa. The celebration of World Malaria Day began in 2007 after the WHO members established the event during the 60th World Health Assembly that year. But before then, it has always been celebrated in Africa. It has always been known as African Malaria Day, right from 2001. But in 2007, the World Health Organization came together in their annual health assembly to create and carve out a day to commemorate the the celebration or the observance of malaria, and also to seek ways to ending the scourge of malaria. All right, moving further to the second key word in our topic, which is effective immunization. Effective immunization. WHO has also set aside this week we are in, that is from the 24th to 30th April, as immunization week. Yes, that is from Sunday through Saturday is immunization week. Is a week that has been set aside to sensitize mothers, to sensitize parents, to sensitize everybody concerning the benefits and positive effect of participating in immunization. This is a whole week's observance, and it focuses on the importance of vaccines to protect people of all ages and backgrounds against diseases that can be preventable with the use of vaccines. So this week is just set aside to observe the importance of the usage of vaccines. And for those of you who don't know what vaccines are are substances or medicines. Let me just say they are medicines that is injected or put in the blood to prevent and protect the body from diseases. It is a substance or a medicine that is transferred into your blood that prevents diseases. And examples of such disease can be polio, smallpox, rickets, and in recent times we have the coronavirus disease, as well as the malaria, which is our focus for today. Alright, as earlier stated, according to the World Health data, as many as 241 million people, that's 241 million people, were infected with this deadly disease known as malaria in 2020. And over 600,000 among these people died as the result of the disease. That's terrible. And the most saddening thing is that most of these cases reported were from Africa. And Africa accounted for 80% of these deaths. So to say, we can decode that this disease is more prevalent in Africa, and it has reasons why it is prevalent in Africa. If you look at the structure and the climatology of Africa, Africa majorly is a tropical area, especially most of the southern parts is a tropical area that has prevalent high temperature, and at some period of the year it is always moisty and wet. And during wet season, malaria occurs through the breeding of mosquitoes. Mosquitoes breed in areas that are moisty and wet. So it is as a result of the way our environment is structured. We also have high transmission rates. That is another cause of malaria infection in places like Nigeria and Africa. And in Africa, the countries that account for the high rate of malaria is Nigeria and Congo. Nigeria and Congo account for the highest rate of malaria prevalence in Africa. Socioeconomic development is another factor that can be looked into when talking about one of the causes or cause of malaria. Socioeconomic development, as our economy improves rapidly, people tend to migrate from sparse area from the countryside, from the rural areas into the urban areas, and this makes the urban areas and the cities congested with a lot of activities, and most of all these activities breeds mosquitoes that makes the transmission of malaria highly potential. We also have another factor known as overstretched healthcare system. Our healthcare system, especially in Nigeria and some other parts of Africa, are overstretched. That is, the facilities available are not well equipped compared to the available number of people that needs the facility. The facility available are not equipped, or they are not enough for the available population. So that is another factor that should be considered when looking at some of the causes of malaria. I don't need to go into details on what malaria is. Alright, although malaria is a curable and preventable disease, when we make use of the correct treatment, we still discover that a lot of people die from lack of access to adequate health care. Yes, there are a lot of things that can be used to prevent malaria, even treatment, diagnosis, using of insecticide and some other stuff like that, but we still discover that a lot of people die yearly from lack of access to adequate health care. That is why malaria and immunization awareness seem to coincide. So I want us to take note of all these things, and the most important thing to take note of is that children below the age of 5, that is from 1 month old to 5 years, are the most vulnerable to malaria deaths, not just contacting the parasite or the disease, but they are vulnerable to malaria deaths. Not just children below the age of 5. Pregnant women also are vulnerable to malaria deaths. Non-immune individuals. When I mean non-immune individuals, I mean individuals who are not, who are susceptible or who are vulnerable to the malaria parasite. That is, foreigners, people whose immune system are not well built up to counter the parasite that is caused or that is transmitted from mosquitoes. So these are the set of people that are more vulnerable to malaria deaths in Africa. And children especially, like I said earlier, account for 80% of malaria mortality. 80% of malaria mortality. That means we have to focus more on taking diagnosis and taking care of the children that are below the age of 5, because as we grow older, our immune system has begun to defend the malaria parasites, even though the malaria parasites can reside in the body. Our immune system in this part of the world has been built up to withstand the pressure of malaria parasites. However, the hope of ending the scourge of malaria received a boost sometime around late 2021, when the World Health Organization approved the use of the first ever malaria vaccine known as RTSS. The first ever malaria vaccine known as RTSS.
Exclusive to JohnBase.com.
It's also referred to as Muscurix. I think that is the brand that was brought to Nigeria last year. So with these vaccines, a lot of help has been rendered to impoverished people in rural areas. And we'll take a short break, and when we return, we are going to discuss about some malaria tips, some things you need to know about malaria and also talk about ways the World Health Organization have made to eliminate malaria in our society. Let's take another message from World Health Organization.
In 1796, Edward Jenner created the first vaccine to protect people against smallpox, which ultimately started a journey toward WHO declaring its eradication in 1980. Polio is also on the brink of being consigned to history, and vaccines have been the single most effective tool for saving lives and livelihoods in the COVID-19 pandemic. But the past 2 years have also underscored how important it is for vaccines to be accessible to all and equitably distributed. Although vaccines have been around for centuries, there are still major challenges getting this life-saving tool to the people that need them the most. Currently, 11.4 billion COVID-19 shots have been distributed around the world. However, in low-income countries, only 1 in 10 people are vaccinated. The pandemic also interrupted immunization services and led to a resurgence in several deadly childhood diseases like measles, pneumonia, and diarrhea. Health systems have been overwhelmed and without sufficient supply, and vaccination campaigns didn't reach the people they needed to. At the same time, a flood of disinformation has undermined people's confidence in vaccines. This World Immunization Week is the moment to get essential immunization back on track and launch catch-up campaigns to ensure that everyone, everywhere, has access to life-saving vaccines. I thank you.
Malaria, to put it like you say for a layman, is one of the diseases or sicknesses, if you want to put it that way, that we have to battle with, especially in this part of the world. Malaria is caused by mosquito bites. And gives malaria parasite, and because it's not something that is used to the body, it causes the person to have symptoms, pains, condition that is not good, and they will say the person is sick, and so the person needs to go to the hospital or need to seek medical support or advice to get treatment. If you look at the burden of malaria around the world, it hits more in Africa, and when you bring Africa out again, it hits more in Nigeria and Congo, the DRC, Congo, because these are the places where the burden of malaria, and once you don't treat malaria or take care of malaria in these two countries, then you've not really done anything to the malaria burden around the world. So we in Nigeria are so happy that this is coming up, and because it's targeted at children under 5, we believe that if we're able to use this very well and we're able to help create access for children to get it across the country, no matter where you're staying, no matter who you are, it will help us in this fight generally to reduce the burden of malaria in this age group, and gradually we can get to eradicate malaria. Who knows? The vaccine is still being developed for other ages and for other part of the world, but right now it's straight for Africa, and if we get it right, the vaccine will be available and it will help in the combination of other strategies I've talked about, and very soon we'll have to clean the malaria from Africa. Over the years and through history, anytime you talk about vaccine, people formally come with this hesitancy. People are worried, people are weary, especially because the new thing, everybody's scared and everybody wonders, will this work? But I think if we look at the positive side of the COVID also, I think the COVID brought a lot of attention to vaccine generally. Formerly, vaccines were more for children and maybe a little for adults, maybe for yellow fever or for hepatitis and others that happened. But when COVID came, it became a vaccine issue and it became a discussion point around the world. And with the malaria vaccine also coming around this time, it gave opportunity for us to also talk about it. And just like people are scared about vaccines or COVID and all that, we're also trying to tell people that they don't need to be scared of the malaria vaccine because it has been tested even in African countries. Ghana, very close to us, here is one of the countries where the test was carried out. Kenya, Burkina Faso, and a lot of places. And then this has been proven by WHO to say it is safe. So I just want to assure people that we don't need to be afraid of this vaccine. We should encourage our children to take the vaccine, the 4 doses of the vaccine as it's laid out.
All right, you're welcome back to the program. It's still your health on Ray Power 95.1 FM. Time is not on our side. The first voice you listened to was the voice of the WHO Director General as Dr. Tedros Adhanom Ghebreyesus. And the second voice you listened to, that was the voice of John Ocholi, Director of Programs and Operation, Society for Family Health. They mentioned certain things that people should not be scared to go and get malaria vaccines. It has been tested and proven to work effectively in Ghana, in Malawi, in Kenya, in Burkina Faso. So it has been brought to Nigeria. You can go to the government health centers to make inquiries about it, and anytime you feel certain symptoms that seem as though you are having malaria, symptoms like fever and headache and chills, don't waste any time to go and get tested, get diagnosis, and take the vaccines. All right, we'll be looking at quickly the World Health Organization action towards an end to malaria. The World Health Organization's action, that is, ways to eliminate and reduce malaria in the society. Continuous and focused research among the health practitioners. So we implore you to get diagnosed for malaria infection. And also for our health practitioners, there should be continuous and focused research as well as strengthening our health system. This concerns the health practitioners as well as the government. We as individuals also have a role to play in eliminating and reducing malaria in the society. We should practice protective measures such as the use of treated mosquito nets. Treated mosquito nets. A lot of people downplay the effectiveness of mosquito nets, as well as the use of insecticide. I mentioned earlier that we should be prompt in getting tested, in getting diagnosed for malaria infection. We also have environmental management aimed at removing their breeding sites from our environment, that is clearing of bush, waste disposal, keeping our gutters clean, fixing our potholes and ditches. And the government can also strengthen malaria elimination through their programs. The election is coming, and most politicians now will be promising us in their manifestos, and I've not heard most of them talk about their contribution to the elimination of malaria or their contribution to the health sector. Most of them are infrastructure based, but we believe that the government of the day, or the government that is coming, will look into strengthening malaria elimination. Time is not on our side. The next Oluwayemisi is already in the studio with Olubukola with their program. The next program coming up is Ilu Birin. That's the women program. And like I said at the beginning of the program, I'll be asking few questions, and if you answer these questions correctly, we have prizes we are going to give you. The first question, from last week's edition of the program, I mentioned some food that are not good to the cells, and I mentioned sweeteners, that is sugar. Give me three alternatives to sweeteners. That's the first question. The second question, what's the name of the WHO Director General? The name of the WHO Director General. The third question, the malaria vaccine RTSS, what year was it introduced? And the last question, the malaria parasite, what is it called? What's the name of the malaria parasite? The parasite that causes malaria when transmitted into your blood. What is the name of that parasite? Send your answers to Facebook at Nedu Okorie, on Instagram at Nedu_Okorie, on Twitter at Nedu Okorie. My closing remark: get tested, get diagnosed, inquire and get vaccinated. And also I call on sponsors for the program, health centers, fitness centers and clinics, and individuals, and as well as health practitioners to come and sponsor their program, their products and services on this program. I leave you with this. Remember, your health is your wealth. Your health is your wealth, and don't take your health for granted. Same time, same station next week.
Exclusive to JohnBiz.com.
I'll see you.